All right. Hi, everyone. This is Stephanie with the Patient Story, and I'm really happy to have our guest today, Shelley Brown, who's here to share her journey. That happened a few years ago, but I know, Shelley, you were talking about kind of going through your timeline, and it was bringing up some emotion for you, right?
Yeah, I was surprised. I tend to kind of realize that at the anniversary time of being diagnosed, but answering the questions for you, it brought up a lot more emotion than I expected for being, several years out.
Yeah. Well, we appreciate you, sharing your story with everybody who's going to be reading and watching this. First, how are you feeling today? How are you today?
Um, I'm pretty good. I'm about not status quo. So yeah,
Okay,
yeah.
that's good. That's good. Then let's dive into your story. Shelley, I know you said you didn't have necessarily first symptoms. So how did this story begin for you? How did you figure out that something was not right?
Um, well, I didn't know something wasn't right. I have a wonderful gastroenterologist who is in our community. Our kids happen to go to school together, so I knew her somewhat a little bit personally. But I mean, she's my doctor, and I've had reflux since my second child was born, and so another doctor had said I take prescription medication for that, and they said, you haven't had an endoscopy in about 6 years. You should get one. And so I put it on the radar, and just kind of kept putting it off, and finally scheduled. And then whenever you have a colonoscopy, you usually meet with the doctor several weeks before and get your prep. And so she said, since you're having an endoscopy, why don't you get a colonoscopy at the same time, because you'll be turning 50 next year. And I hadn't even thought about that yet. So it was not on my radar because I hadn't even thought colonoscopy, and I just said, okay. And so that was late summer of 2015. And then I had a virus that I got, and I finally scheduled a colonoscopy, the procedures for October. And then I delayed them for some scheduling reasons. But then in early October, I had a virus, pretty significant virus. And so I was put on an antibiotic that's got some pretty major side effects. And we don't know, but one of them is listed as rectal bleeding. So in October of 2015, I had a little bit of rectal bleeding. I let her and my primary know, and she decided, let's just go ahead and get you in, earlier than your appointment. So that's how I went in. We even talked about that. She didn't expect to find anything. I didn't. I had a little bit of like mucus in my stool off and on throughout the last year or so before that, but I didn't think anything of it other than like dietary changes. I didn't have stomach pain, or a lot of the symptoms we're told to look for, I didn't have.
Gotcha. Okay. And so thankfully, or, by chance, you are put into the medical system earlier and you are told to get this colonoscopy done. So I see you got that done, yeah, at the end of October. First, for people who haven't undergone one, can you just sort of quickly describe, I know it's mostly about the prep for the colonoscopy.
Yeah. And I'm a big advocate for that. So I will push anybody who even mentions that they're putting it off. The colonoscopy is no problem. I mean, you take a nap. I mean, it's great. The prep is the worst part, which people build up. It's really not that bad. There are many preps now too. So a couple of them, the taste of, well, I guess if you like to eat, you can't eat for a day and a half. So that's, maybe a part of it, but you can have, you know, popsicles and Jello and all these things that you normally, you know, candy and things that will pass right through. And but the prep is, you know, it's just a lot of liquid that doesn't always taste great. But there's all kinds of tricks I've learned to mask the taste or you know, hide the taste. And then there's, again, like I said,
what are some of those tricks, by the way? I'm sure people.
well, first of all, getting the liquid into the back of your throat, rather than trying to taste it, having like sucking on like a menthol or a candy that's got like a strong aftertaste before, and then you're supposed to drink a fair amount at each time. There's like, you know, over that 24 hours or so, certain times you drink, you know, 8 to 16 ounces all at once. And so, you know, or every 30 minutes, depending on where you are in the prep. It's about a day and a half overall, at most. And so having something strong tasting in your mouth before, and then immediately popping it in after, holding a dryer sheet over your nose, so that you don't smell it. Because I don't know that it's the taste as much as what it smells like as it's going down.
Interesting.
Those are a few off the top of my head.
Yeah.
But
No, those are great. I think those would be helpful for people, right? I mean, whenever I get mine done, I think I'm going to have those ready for myself. So thanks, Shelley. So you get to go, you go into the colonoscopy, it's your first. And then they find something, right, during the actual procedure. So can you describe when you're waking up, or, you know, when it was that you learned all this information, what they told you?
Yeah. I woke up, and they moved. There's a recovery area, and in clinics, I think a lot of them are at their outpatient clinics usually, or even at a hospital outpatient. And so usually the recovery area is like a row of beds with curtains, like any day procedure thing. And so they, I didn't go into the same curtain that I came out of. They put me down one at the end of the hall. And I joked to my husband, I said, this is the one they bring you. You're just waking up from anesthesia also, so you're a little loopy. And I said to my husband, this is the one they bring you to for bad news. And I didn't know that I was accurate. That is true. My doctor later told me. And so we waited for her, and it was maybe a little bit longer. Sorry, this part will get me. Because as I said, I do know her, and she came out with red eyes and tears in her eyes, and she sat down and she said, Shelley, you have cancer. And the first thing I did was laugh, because I was just, that wasn't even on anybody's radar. I mean, I have family members with like colitis or, you know, irritable bowel. Like we thought afterwards, talking, like maybe the worst thing is I just should find like something for, you know, a manageable stomach condition or GI condition. And then I'm, you know, like, really? And I think then my husband started crying, and then I apologized to her for having to tell me, because I couldn't imagine being in her shoes. And then I think I started to, you know, sink in. I mean, I knew what she was saying. It wasn't that. It was just, I was so stunned. And she, bless her, she'd already been on the phone with the surgeon, and had me, I was a late appointment because they'd put me in. So this was 6 o'clock on a Monday night. I had an appointment with the surgeon set up by her the next day at 1, and she had me go get blood work that night at the hospital across the street, and she had me set up for a CT scan at 7 the next morning. So she was like, had all that done before she even came to tell me. So it was an utter, I mean, it's always a shock, but we didn't go in you know, with a lot of symptoms where we thought something's going to be.
Right. Like you said, it wasn't even on your radar. You weren't thinking that at all. By the way, it amazes me how, I don't know if selfless is the right word, but you know, you've just been told you have cancer and there you are apologizing. I know because it's your friend and you feel for her, but it's always sort of stunning, you know, to me how.
Yeah, I can't imagine having to tell someone those words.
Right. No, I don't envy their position, especially someone who knows you and is, you know, has this personal relationship with you. But in a sense, how wonderful, because it seems she really went to extra lengths to make sure that you were set up, right? And that's where it varies for people's experience. If, you know someone, maybe they can pull an extra string, get you in right away. Other people may have to deal with the wait. But regardless, Shelley, so obviously it is crushing news. Your husband's with you, and breaks down. How else did you have the time to tell other people? I know you have kids, and so there's life that you have to deal with too.
So we took that time that evening. We had a family friend home with our kids because it was a Monday school night. So and she's like a godmother to me, lives in the same community. We don't live in the same city as either of our parents. So so first my husband called her and asked her if she to stay, and then I was at the point where I couldn't call anybody because I think I couldn't say the words. I was not able to say she found cancer. So my husband called my parents, and we might have been on speakerphone, or maybe I did, but my parents they live in Hawaii part of half the year, and so we called them, and my mom said, "No, you don't." I mean, she was so, they didn't believe it. They thought it was wrong. They were like, "There's no way she can tell just by the colonoscopy. There's got that can't be right," you know. So they went immediately into this like denial of like, this can't be happening to our daughter. And then I don't remember where it went from there, how much explaining we had to do to them, give them. But I mean, it sank in pretty fast, and they were amazing. And then my husband called one of my best friends and told her, and then asked her to tell. I called them. There was some people that helped me. Well, we had a tremendous amount of help, but I've been blessed with some great friends in a community that, you know, we don't have family in. And so she called a few close, like 3 or 4 close friends, because I had active kids at that age, you know, and there was a lot of things that weren't going to like immediately weren't going to be happening, like with, you know, the next car driving, because all these appointments were happening. And so, and I think and he probably called his parents. And then I remember we went and got something to eat while we were waiting for the blood work, and that's kind of all I remember that night. I mean, it wasn't
a blur,
you know,
right?
We weren't home late. I mean, we probably got home 7:30 or so, but I don't know where it went from there.
Well, I what I hear from you is, you know, and it's sort of nice tips for other people too, is to have, you're not going to, a lot of times maybe have the bandwidth to be wanting to tell people. And it's your story to tell too. So you decide when you want to share the news, but to have a caregiver or somebody else, and then they can tell maybe a close group of people who can help figure out those next steps, since, you know, you had kids to deal with and make sure they were taken care of, and all this other stuff. So I'm glad that you have that support system there in your community. And I know it moved quickly because you had that surgeon appointment the next day, and then the CT scan the following day, plus another follow-up CT scan the day after that. So can you describe the meeting with the surgeon, what he or she said, and then maybe describe the CT scans as well?
Yeah. So the next morning, the first thing was the CT scan, and I don't know if I had ever had one. Well, I certainly hadn't gone in by myself to the hospital. My husband was home getting the kids off to school, so I went in and I just was, you know, that point in this surreal world, like what is happening, and so I had to drink contrast. So sitting in this waiting room of the hospital, you know, radiology area, and drinking this contrast, and just sort of terrified, numb, and letting time pass, and then the CT scan itself, if you haven't had one, they're a little strange at first, especially with contrast, because they take you lay down like you're getting an MRI or an X-ray if you need to lay down for an X-ray, and similar, you kind of get slid into a machine, not quite so tight as when you get an MRI, but then they put an IV in so that they can add additional contrast during your procedure. And it's a bit of a strange feeling, because they tell you, but basically when they like open up that line, your whole body gets like this, it gets into your bloodstream, and you feel this rush of warmth go through your entire body. And so it's a little strange. I wouldn't say scary, but a little strange.
And since you mentioned it, you also feel like you have to urinate, right?
Yeah.
That too. It's like, and it really feels that way. They warn you. They say you're going to feel like,
because it goes right through every region of your body. Exactly. And so it's not too long. And then, and so I left. I mean, I'm sure I was anxious for the results. I knew that I had cancer already. I mean, it was, you know, I didn't understand at the time, because a lot of times you hear stories of people that it's the imaging that confirms it, or which of course the imaging was going to confirm other things, like, you know, well, validating what she'd seen, but then kind of, you know, more detail on size or anything else they might need to be aware of in the CT scan. And so I don't know, things were happening so fast. It's not like sometimes where you're just sitting by the phone waiting for the results in a panic, because there's so many other things happening. So then my husband and I met with the surgeon that day at 1, and he had he does a lot, you know, he's very respected, and he and his business partner do a lot of surgeries around this area, and you know, familiar with the surgery, obviously. And so he explained to us that, you know, he'd be going in and removing the tumor, and that I would be getting a colectomy, I guess, where they take out a certain section, the amount of your colon they need to take out in order to get clear margins, and that they can also ideally stitch back together, which is and so they don't know until they go in, you know, and they prepare you for other things, whether you'll need you know, a bag, or you just don't know, because mine was in the sigmoid colon, but it's also was very low on that left side, which then comes close to being in your rectum. I did not have rectal cancer, but you don't know a lot of that. And then he explained to us they would be looking for margins and taking out lymph nodes to test, and he wanted to get the surgery done soon. They thought they caught it early, just, I guess, I don't know. I don't know. Everyone kept saying they thought they caught it early. But at the same time, they somehow seemed to know it was aggressive. even before all of the pathology.
Mm.
So he wanted to do surgery the next week. My husband had a work trip, so he wanted to know if it could be postponed for another week, which it was. So yeah, that was it through the first round, the surgeon.
Gotcha. So, and then before I forget, you had the follow-up CT scan because they had spotted some nodules on your lung, but did that turn out to not be anything?
Yeah, they were, so they'd seen nodules in the CT scan that were concerning enough. They wanted to get a better look at that area. The nodules were still are, they're kind of always an issue that they're watching and hanging.
Gotcha.
They've never gone in to biopsy or go, but they show up.
It hasn't crossed a threshold where they're super concerned about it, but it's something they're paying attention to.
Exactly.
Gotcha. Yeah. Well, I'm glad that didn't turn out to be something, imminent, because you're dealing with so much, with so much on your plate already.
Well, that was, yes. Oh, sorry. That was funny because that was the CT scan, the second one, where I do remember waiting and it feeling like forever, and how I spent a day, I just found out I had colon cancer, and then she called with the results that there were just nodules. It was fine. And I remember jumping up and down in the kitchen. And then I remember just pausing and laughing and thinking, oh my gosh, I've just gone from like finding out I have colon cancer to then jumping up and down in happiness that I don't also have, that it hasn't spread to my lungs, like all in like 2 days. And there was just the moment of humor, like that I was celebrating this other thing where, 2-3 days before, I didn't even know I had anything wrong.
Right. I love that you bring that up though, because to your point, it's like you have to kind of celebrate each win along the way. I don't know if you struggled with that. We could talk about that later because I know I did. I didn't want to celebrate anything prematurely, but I'm glad you had that moment. And I know that it moved quickly still even after. By the way, with colon cancer, is it that they can't stage you until after they go in with the colectomy and really see what's going on, right? And then biopsy or send to pathology, and then they really figure out the details?
Yeah.
Okay.
Yeah, they need the number. It's they need the tumor, what the tumor looks like,
right,
what areas of your colon and your system is it like invaded, like
right,
the outer wall of your colon or into another area, and are there lymph nodes that and how large are those lymph nodes, and how many of the ones, they want to take as many lymph nodes as they can.
sure.
And then they look for cancer in the lymph nodes, so how many of the ones they took are positive, and all of those things go into staging.
Right. Okay, thanks for laying that out. I know before you even find any of that out, you're meeting with an oncologist that following week, the week before you actually went in for surgery. Do you remember what that conversation was like? I mean, what were they able to tell you about your treatment plan?
Yeah, he was pretty, just casual but straightforward. He again alluded to that, it was doubtful that I was going to need chemo. Again, everyone, I don't really know why. I guess because I didn't have a lot of symptoms. I guess because I was under 50. There's all kinds of reasons that they thought it was caught early. But so he, didn't go into extensive detail, except for by this time my mom had arrived in town and was there for the duration, and my dad came shortly after. So she was at all the appointments with me and asking lots of questions also.
Which, by the way, is a great idea, right? To have other people there.
I think that's, if possible, critical, because we both would go with our notebooks, and as a patient, you're going to be asking questions, but you're also going through the emotion, and it's you. I mean, of course, the person with you, whether it's a spouse, a parent, a friend, you know, any kind of caregiver, they're having emotions too, but they're going to hear different things, or maybe think to ask different things. And I think as much as possible, it's critical to have someone at every appointment. And so we would go, my mom and I both would walk in with a notepad, and sometimes it would be my mom, my dad, my husband, and I all sitting there with notepads. And then my mom would take the notepads, and then she would actually write everything out based on what everyone had asked or heard, or and so that was really helpful. But so the oncologist, you know, described what we kind of knew. I mean, the surgery, that the recovery time, so his estimate on when I would see him again, I would see him regardless. And so when I would see him after recovering from surgery, and then any decisions about treatment would be made, and talked about what kind of treatment, and for how long, for what, you know, stage is kind of potential, but kind of a general overview, and not, you know, not a ton of detail unless it was questions that we asked.
Yeah.
And what they call the chemo, because they call it adjuvant, or I'm not saying it right, but
yeah, no.
Where you often get chemo when they think they've gotten everything, but they don't know, because it's maybe hasn't gone to another organ, but it has gone into basically your bloodstream. It's outside. It's not contained in
Right.
in the site that it was found. In my case, the colon.
Right.
So the chemo for that is to try and get any cells, cancer cells that might be in your body, going to find somewhere else to land. And so that's the reason they really push chemo. And so that's a lot of what he explains also, because not everyone chooses chemo, or gets it, or it's recommended. And again, depending on the stage, whether you're stage 2 or 3 or.
Right. It depends on all those details. And it was really an introductory meeting to just sort of get a lay of the land of what might happen, what might not happen. I know that the following week, literally a week later, actually, you went in for the big surgery.
Yeah.
Can you describe what you remember of, I know you were asleep for the actual surgery, but maybe going into the surgery, if there was prep, how you mentally prepared yourself as well, going in, and any advice you think might be good for people to hear who haven't gone through any major surgery yet?
Yeah, I think going in as positive as possible. I had, the night before, I was listening to and journaling, while listening to, we ended up doing a caring bridge, and I think it ended up on there at some point, or on a little blog thing I had done, but writing about what was happening, to listening to one of my lifelong favorite musicians, and just visualizing, I will be healthy. I had like 3 words, and they varied along the way, but I would pick words. And then the day of the surgery, same thing. My husband and I, we had music playing in the room while we were waiting for surgery. And then we already had a lot of support, and, you know, cards and help, and, you know, gifts, gesture, you know, things like that. And when I went into the operating room, sorry, this is like another emotional moment. I visualized everyone in there with me. And that's like, you know, dozens and dozens and dozens of people I visualized them all in there with me. And I just, it was important to me to engage with the staff in the operating room too, just whether it be, a joke or just hello or thank you or anything, just for my comfort, but also to humanize the whole situation, I guess.
Yeah. Right, because it's such a sterile environment, so you're trying to humanize for yourself. By the way, I know, and don't ever apologize for the emotion that's come up, but I'm curious, what about that moment for you kind of evokes that emotion?
I guess just the love and how many people we were and are blessed with in our lives, and you hear about it, but you really see it when it happens to you, and it will happen to everybody, I'm sure, at some point. Hopefully not, but maybe some of us will just die quietly in our sleep. But when you go through some sort of crisis like that, you really realize the people that care and the people that are there and step up, and so I just felt like the more love that I had with me, the stronger I'd be to get through it.
Yeah, that's beautiful. I'm so glad you were able to envision that for yourself. And I love the positive affirmations you were, reciting and telling yourself leading up to the surgery. I think that obviously built really good energy for you.
Yeah.
Yeah.
Yeah, I came up I will be healthy, I will heal, I will thrive, I will survive. And I would change it up some, but I would say that, well, pretty much daily or some version.
I love that. Can you say that again? What was it? I will.
I will be healthy, I will heal, I will thrive, I will survive. And it might be in different order, but those were the words that I used.
Thank you for sharing that. Hopefully it'll help other people too. So how long was the surgery? Do you remember? And when you woke up, I know it's a pretty big surgery, so the recovery is intense, I'm sure.
Yeah. I don't know how long. I'm sure I know I have it written down. I think the surgery went pretty smoothly, as it were. I'm thinking it was 3, maybe 4 hours, and it wasn't longer than that. It could have been a little bit shorter, but it was long, but not, you know, like some things you hear about.
Yeah.
Um,
Can you describe the waking up and the recovery from the surgery?
yeah. Well, apparently, and which is not usual for me, but apparently it took a long time to wake me for just and that has to do with the anesthesia they give you, and I think how long they estimate the surgery and all of that. So I know it took a long time for me to wake, and then um, I don't. I'm trying to remember what they.
How long were you in the hospital, I guess, after?
So I was in the hospital. They said to expect up to 5 or 6 days. I was. The surgery was the 10th. I was originally discharged the 13th, which was pretty quick.
Yeah.
I unfortunately had to be rehospitalized the 16th through the 20th, related to the resection of the colon and what they call ileus, where basically partly due to the anesthesia, partly due to them reconnecting your colon, and medications you're on, and basically nothing was processing through my body. So I was just, pain, a lot of pain, but just getting large. My colon was just expanding everywhere.
Oh.
But the first, I, I remember, I knew enough when I first woke up, um, that that was the first big blow. I was also blessed, that our neighbor at the time that lived behind us, that we were friendly with, we live, I mean, it's not a small community, but it's small enough, I guess. He's the head pathologist for that medical system, and he put himself on my case.
Wow.
So he was in the operating room. So before I had even woken up, he had brought in like an initial report, which normally we wouldn't get for several days. It was enough. And then he came and saw me. And it might have been when he came and saw me, but we knew the afternoon of my surgery, essentially how bad it was.
Like the staging and everything, he pretty much.
Pretty, not pretty much. Yeah.
Okay. Wow.
So
It says that you got the official diagnosis the day after the surgery, but really it was that afternoon you already.
yeah, officially, yeah. So the official one from the surgeon and like the final report was the day or two after surgery, but the one that we got through our neighbor connection, our friend connection, was right from surgery.
And he himself talked to you that afternoon, or was that okay?
Came in and he gave us, well, he asked if I wanted them, but that's who I am. And he even gave us pictures of the tumor. So
what was that like?
Well, if you don't think about what it is, well, it's just it's ugly. But it made me, and you could see, it gave a very vivid picture of, no pun intended, of what was really not right.
Right. So in that moment, do you remember how you and your family processed the staging? So, I mean, it was 3B, and we know that the higher the number and the later the letter or whatever is not really what you want. So
no. So I'm a avid wannabe, I don't know, maybe in my next life, medical researcher, or any researcher. I research a lot. And in regards to my cancer, just as a note, I do think it's important for people to learn as much as they can. Not everyone is a researcher, and people have to consider how it impacts them. For me, the more I knew, it didn't make it worse for me. It, in a way, it gave me more power, because then I wasn't shocked, or I took it. I was able to sort of separate that, all of those things I learned, but I wasn't just reading mainstream medical things. I mean, I would, like major hospitals or studies done by hospitals, or of course all of the cancer sites and the medical sites, but I would read, I would subscribe to medical journal things that you had to access, have a password, and I say that part, I truly mean to it's important to know enough, because that's the way you have to advocate. And that's a side note, I'm sorry. But for me, when we found out, I knew way more than my whole family. And so I was crushed. And I knew what it all meant. They, I mean, I won't say we were arguing, but no one else knew what that all really meant to me.
Mm.
So,
And
I
what
mean,
did that mean to you in that moment? What were you thinking?
well, I knew that it would mean recommended minimum 6 months of chemo. Um, I knew that it was outside my colon and had invaded the tumor itself had invaded the outer colon walls. Not entirely, but just enough that that's part, so the lymph nodes. I knew, the size of the lymph nodes was not good. Um, I mean, I wasn't stage 4, which thank goodness. But I knew it was about as serious as it could be without being stage 4.
Right, right.
And I was terrified, and I was a little angry at everyone for telling me it was going to be,
Yeah.
We're going to get it early kind of thing. I was like, felt misled. So I had all kinds of emotions going on, but basically that's the moment where I feel like my world sort of crushed.
Right, where the hope kind of you had the answers, and they weren't the ones you were looking for.
Right.
And I think, the way that you explain it, I mean, it says something about expectations, right? Um, and that's oftentimes why doctors won't tell us anything at all, because they say anything and then it's off that path. I mean, there's just very little upside. And I feel like you really dealt with that. You were told over and over again, don't worry, we've got it early, we've got it early. And then you research everything, you hear 3B, and it's like, what? What's going
Yeah.
on?
Yeah. So, but in a way, again, I'm not sorry that I had that knowledge,
Right,
because I could begin to deal with it and process it.
right. So true.
And so it wasn't was one blow instead of multiple continued.
Right. Um, yeah, I'll say I've interviewed a lot of different people, and you're one of the few who I think has taken the approach of let me learn everything. And I know it's a personal decision, it's also personality, but it is great advice in that if maybe the patient, him or herself, doesn't want to do it, to have caregivers who know, because you need to have advocates, best if it's you, but
Mm-hmm.
I do want to dive into that when we talk about all those things at the end, because self-advocacy is one of those pieces that I think patients
Yeah.
and caregivers need to hear.
Yeah. In my case, my story could have ended quite differently had I and but myself, but a few other people really learned everything we could learn.
Mm,
Um, and also, as you said, I mean, critical is self-advocacy. I mean, I know there's too many stories I know where things could have gone differently had people felt that they could advocate for themselves. And it is hard. It's
right,
hard to stand up to someone in the medical community in a position of power.
right.
But as I kept being reminded, they're human,
Yep.
they make mistakes, and they are working for you in a way.
Very, very.
Um, so I think that, again, you said you have to do the amount of research, learning that you can tolerate without it hurting you, being a negative. But the self-advocacy, whether it's you or whether it's a caregiver, there's got to be someone,
Yeah.
in any way possible, pushing the envelope for answers. And I just think that's
It's so
critical.
important. Yeah, it is critical. So we will definitely get into that, and especially as it pertains to your story, where you felt you needed to advocate the most. it says that your first chemo started about a month and a week or so after the surgery, maybe a month and a half or so.
Yeah.
Yeah, was there, well, and then I saw you got a port, which not many people get infections, but it looks like you might have had one. I had one too, actually. But quickly, I guess maybe the port, did you end up using it, or did you have to go to PICC line? Or okay.
We did end up using it, yes. The long answer is years, even to this day. I've just figured out what I'm allergic to, that has caused a lot of the type of struggles, that because the infection was not the line itself, it was external, but my whole skin, they couldn't access it because it was just too infected.
Was it the bandaging or the?
Yeah, there's two. I'm allergic to two different acrylites, which are used in a lot of adhesives, medical tapes, Dermabond, sutures, nail stuff, a lot of like glues and a lot of things that are used in medical,
right.
Anything, and from the prep clean and all of that. And so, I mean, yes, just literally within this year, within the last 6 months, because I had surgery related to cancer, but several years later, but and I had another infection. And anyway, the bottom line is, yeah, we finally figured that out.
But that's the thing. These things do happen. I was allergic to adhesive tapes and other things. Maybe that's part of, what happened with me too. But most people don't have infections with ports. That's at least what they say.
That's it. Yeah, it's uncommon. And the port itself, I mean, if I sat and thought about it, it was sort of a freaky thing. But I'm so thankful for having it. I had a family friend who didn't have one, and what it does to your veins and the amount they use it. So other than it just, seeming kind of bionic and futuristic,
Iron Woman,
they really work well.
Right. Yeah, it saves your veins, and it's very effective. So the port is what you ended up using. I know you said it started with FOLFOX. And that started in December. So can you describe the cycles? I know then it says it switched to FOLFIRI. We'll talk about the delays in a second, but yeah, if you could talk about the chemo regimens and what that looked like schedule-wise.
So from my case, for stage 3 colon cancer, they recommend, at the time, that might be changing around now. There was a lot of studies, and I say that because I know the audience now might be hearing different length, like 3 months instead of 6, because there was a lot of research being done at that time. But when I had mine, it was still 6 months, and you would go every other week. You would go in, you'd spend 5 or 6 hours, you would get pre-meds, and then you would get the chemo agents, and then they would hook up a line where you would carry basically like a bag, fanny packs type thing, that you would wear for the next 48 hours at home, 24/7, and then you would go back in. So say your chemo was Monday, then you would go back in Wednesday from them to remove the
pump,
the take-home therapy, the pump, and then you would be let go
for a week and a half.
For a week and a half, and do what you felt like you could do, depending on the side effects.
Right. Yeah, I dealt with the take-home pump too. I had to take it home for a week, and whenever I talk to people about it, it's like I still hear the whirring.
Yeah.
that sound. Do you have any tips for people on how to deal with the chemo regimen with the pump, anything that you think might be helpful that you learned?
Well, I had to get a cute chemo bag. I didn't want they may be better now, but originally the ones from they wanted to give you, and people make them, that are just, because you've got to wear it. And I often would wear, I don't know about you, I ended up with a bit of a wardrobe change that people don't talk about, but with the a port, well, females mostly, but you have to really get all new undergarments because of where the port is. So, and that's something you'll learn and they'll tell you. And then you have to wear clothes that are accessible for the port. So, getting new, well, you just have to have wires that are much further out so they can access, and so it doesn't hurt. And then a lot of like camisole tank top things and then a lot of button downs, which wasn't something I normally wore, but all of those things help with them accessing the port. And then it helped with the chemo bag because I could wear the chemo bag over, maybe this isn't what people want to know, but there might be some, I could wear the chemo bag over like the tank top. And then I had like the button up shirt or a big sweater that, not that I was trying to hide it so much, but it was just more comfortable because you also have the wires or the line. And so I could kind of tuck those lines, into the tank or camisole type thing. And it just made it more comfortable, not so much about hiding it per se, because I still had the easy access to it. The sleeping I got, it is an adjustment. Like a body pillow helps, I think. A lot of pillows, because depending on how you sleep, you may have to change how you sleep. And then, I kind of got used to the sound, but, earplugs help too. And as far as the chemo days, it helped me, and there's a lot out there on it, but I had a specific chemo bag, which I don't know about other people, but I didn't want to see that chemo bag after after all that time. But I had a chemo bag that I just kept with snacks and a blanket and, extra chargers or headphones or things to help you, a little like head pillow. They have a lot of that at the clinics, but the comforts of home, comforts for you, that, I was given like a teddy bear after my surgery that went with me, things like that just made it more comfortable and made the day pass. And
humanized things like the way you had described before, which is so important. Yeah. So I those are great tips. And the loose clothing applies to anyone and everybody, because whether it's a bra or just the clothes outside, I mean, these are all things that do change and have to be considered. The easy access, the comfort, things that aren't tight, that won't be, pressing up against it. It's all really good advice, actually. So thanks for bringing that up. I actually forgot about all that.
Well, also I didn't think with, and I ended up with different pants too, because colon cancer, it is a major surgery. It takes a long time to heal. So a lot of times where the scars are where your natural pant line would be. So ending up with things with elastic waists, that you could kind of adjust the height of, you just, and that's something that people can do before treatment begins too. And it kind of helps pass those days, weeks before, the treatment begins, but that does make life a lot more comfortable.
Right. No, and these are the things that are super important, I feel, Shelley, because we don't have control over how our body reacts or over the treatments that we're going to undergo. But we do in terms of the day-to-day comfort and trying to just make it a little bit better. It actually makes a huge difference, even though it seems small. So these are all great points. Before we get into what actually happened, I know there was a big delay. Just in general, if you were to talk about FOLFOX and FOLFIRI in terms of side effects, that were the more common ones, or, not the severe allergic reactions, but was there nausea like a couple days after, and then how did you deal with the side effects?
So I was basically on FOLFOX. I had one cycle of FOLFIRI. So FOLFOX, which is the recommended for my stage, and that's what I had for basically the duration. They pre-medicate you with not medications for nausea. I still did get nausea. So there was other medications I take that could take home that are pretty common for people with nausea, but I'm prone to it. Thing is, different people are prone to different. Some people, I had a family friend who was on FOLFOX for a year. I don't even know how he did it for so long. And he was truly a warrior with it, and didn't have a lot of the side effects. So a lot of it depends on, I hate using the COVID word at this point, but, the makeup of our body and our immune system and all of the other pieces that I don't understand also have to do with which reactions and how strong they are. For me, I guess I tend to react pretty severely to a lot of it. I had the nausea, fatigue, I had which isn't uncommon, but a lot of skin rashes and whatnot that, were some of it tied to the chemo agents, some of it not. If they give you a list of the expected side effects, I had the majority of them to different degrees. I think the two hardest ones in that kind of small world problems were the not being able to drink anything cold, liquid wise. I love Diet Coke. I'm not a coffee drinker. Water, I still struggle. I loved water, but changing that to warmer room temperature, it kind of just has had this longer effect. I don't love water as much, because anything cold, when you have FOLFOX, your system you start feeling like you can't breathe, which you can, but tied with that, you get these cold zaps, which you just get them, and I don't even really know how to describe them, like little mini lightning things or something through your fingers, but especially even again, picking up a cold glass, opening a cold car door, trying to pick up an ice cube, forget that. So you again, that would be another thing. I got tons of these white cotton gloves, and I just had gloves too. But, if you were trying to do things in the kitchen or whatnot, that you could just use those gloves and throw them away, because, your hands are the things that touch things first and foremost. But those were the strangest kind of thing. You can't really relate to any other experience, I guess, that and the intolerance to cold liquid, even cold air.
Right.
If you're in a cold air climate, you kind of got to have a whole scarf over and breathe into that, because breathing in the cold air has that same sensation.
Right. No, and I've heard that before. And you describe it as small world problems, especially, I'm sure, relative to what you experienced outside of this. But the thing is, I think it actually makes a huge difference, because we don't realize these things till we're experiencing them, like how often we touch cold things or how often we're drinking things. And so those are great tips. I'm glad you brought that up. Okay. So before we go into the delay, when you finished out your chemo cycles, how did treatment end for you in terms of, did they have a scan? Was it, okay, we've done the protocol, we're just going to keep following up, and as long as you don't exhibit anything, you're considered no evidence of disease? Or
I believe they usually do a scan towards the end, in that last, there's a point. Well, it might be at that point I had scans every 6 months. And so the first scan would have been in October. So I had a scan around March. I think it maybe would have been, I needed it for something else. Again, I've had just chronic problems with my GI system ever since the resection. But I think they do a marker basically somewhere towards the end of treatment of doing a scan. They draw your blood work, your CEA cancer markers for, I know they're different for different cancers, but they're looking at CEA levels for colon cancer. Mine were, even with stage 3 cancer, was only, I think that, so no sign of cancer is anything below 2.5. Mine was 2.6. So I never really relied on that. But they do draw that every week when you're in treatment. But at the end, they do the CT scan. They would have done the CEA, and then they schedule you for, depending on your situation, a colonoscopy is going to be in there. And then at first, the first year was every 3 months. I would meet with the oncologist and just meet with her and do blood work and physical exam. And the CT scans were, I can't remember if they were once or twice a year. It might have been twice a year for the first year or so. And then it gradually jumps. So then at 2 years, then you meet with her every 6 months and get the blood work and meet with her. And then,
the frequency starts to go down in terms of need to check up. And that's
there's 5 year, in colon cancer, it's 5 years, which I think is pretty common for most.
Yes.
The recurrence can happen soon if it happens, or it can happen after, but they see the most percentage-wise in around like 2.5 to 3.5 years. So they still keep you about every 6 months. So I just got to the 4-year.
Ooh, that's awesome.
That pushed me. Thank you. I think that pushed me out to seeing her. So I see her at 6 months, but the CT scan, and then then it will be as needed. But again, I don't put a lot. CT scan I put a lot into. I don't put a lot into the blood work, because my percent chance of like that didn't have a factor for me. I don't put a lot into the percentages because I really didn't have much of a percent of chance of getting it in the first place. and even into the treatment. I mean, they say with adjuvant chemo, I don't know if this is relevant, but I think I found it really helpful with colon cancer and chemo for people that do the adjuvant who, they think they got everything. It's not in the lung or in one of the places that it tends to go to soon, if it's gone before. They say they figure about 30, to example, like 30% they'll catch anything out there, 30% didn't probably need it, and 30% are going to get it again anyway. Which I thought was, again, it's statistics, and they don't mean anything.
I think you bring up a great point too about the numbers not meaning anything, because it's just, we could be on either side of the coin. And so, my oncologist had said something similar when I started too. But now we're in the I'm really excited to talk about these next few things, and then we're done. You've spent so much time with us already, so thank you. Before I forget, I know hair loss means different things to different people, but it's one of the first things a lot of people think about. So if you had anything to sort of describe your experience and have any tips for people, what would you want to say there?
That was a big one for me. I've always, with a few exceptions of like the Dorothy Hamill when I was younger, or I've always had long, shoulder to long hair. And that was, it's not so much vanity like people might think. It's part of your sense of self. It's that walking by, looking in the mirror and not feeling like it just adds to that whole out of body experience. Like I didn't mention, but you get a lot of steroids. And so I was quite thin, and they wanted me to put on weight beforehand, before the treatment. And then I just kept gaining some weight. I mean, I didn't get like obese, but I got where I didn't look like myself already. If you add that, and then the steroids, and then you add the hair. The hair it's just part of my, I don't think I look good with short hair, for one, personally. It's with the treatment that I had overall, most people get their hair thins. You may or may not have to cut it. I had this side thing happen where I went to the treatment for one time, where you do lose your hair more. So I don't know if I lost, but I lost enough hair that at first cut it a little bit shorter. And then it was to the point where I didn't want to be obsessing about it every day and worrying. And I didn't want cancer to take my hair. So I decided to cut my hair. I already had pretty thin hair, and so my stylist cut it for me. And then I had some dear friends go wig shopping with me, and I had our community donated money to buy me a wig, which was mind-blowing, because not everybody understands how much that can mean.
Yeah, right.
So I had a long-haired wig, and we ski a lot, so I would just wear hats with my long-haired wig because it never really looked normal here. But and that helped me feel more like myself.
Right.
I mean, everyone said, "Oh, your hair looks cute short," but I didn't feel like me.
Right.
And anytime I see a picture of me with my hair short, I think of cancer.
Right.
So
it's like looking sick is part of the whole thing for people.
Yeah, and again, that drew, again, in your community. I was very open, and I started this caring bridge that I wrote a lot, or my husband wrote, but part of I just thought, if this happened to me, there's no genetic history in my family, because I was under 50. They did all those tests. Wasn't a genetic cancer. I didn't meet any of the criteria of people that they say might get it. Like male, eating red meat. I'm a vegetarian. Like there was like, I didn't have any of the underlying risk factors. It just happened, which is that life happens. And so I felt early on, like, if anything is going to come out of this, it's got to be that I share my story so that it doesn't happen to anybody else.
Right.
So I was very open, but at the same time, I hated going out and being the cancer girl.
Right.
And so it was hard to feel like I looked like I had cancer, even though everyone was super kind about it.
Right. No, that's, it's it's one thing to hear stuff, but to really feel what you feel internally, that's a whole nother story. I also wanted to ask you, because you talk so much about self-advocacy, could you describe what part of treatment for you felt you needed to advocate for yourself the most, if you could summarize that? And then really would love to hear your message to other people on why self-advocacy is so important.
Yeah. Well, I mean, I'll say, to put it simply, in my case, and in the case of a family friend, whose mom, who's no longer with us, but in her case, self-advocacy could have saved her life. In my case, a lot of things saved my life. My surgeon deciding to do a colonoscopy. I mean, I feel like I have a lot of people saved my life. But I also feel that self-advocacy likely saved my life. And self-advocacy, sorry, those words aren't coming out today, isn't easy for a lot of us. And it's especially hard when you're going through something traumatic. But it's so important. And so, trying to be brief, after my first chemo, I had some really horrible side effects, and was in and out of the emergency room, and they were, trying to figure out what I was reacting to. And, they didn't necessarily know which agent, or, it's hard to know, but it was all documented. When I went in for my second chemo, my oncologist had been out of town for a bunch of that time because it was around the holidays. But in the meantime, I had learned, well, anyways, I went in for my second chemo, and, sorry, I'm gonna go back. So by the grace of, I don't even know what, the universe, a friend of ours sent me this article about this rare genetic deficiency that can be fatal in cancer patients, and it's a DPD deficiency. I won't go into that, but it's not common. There's like 5% of people that have it, and so it's a deficiency that's not common, but that there is a test for. It's, I guess, an expensive test, and my oncologist wouldn't do the test. And we had suspicions that maybe that might be the case with me because of the symptoms I'd had, that severe reaction after the first chemo. So they did the second, they wouldn't do it. So we agreed, we did the second chemo, which has one of the same agents, the one that the 5% have a genetic inability to process. And as a result, not only, so the chemo they switched me to isn't known to be effective for stage 3 cancer. And I had read a lot about that. So after that second chemo, it was concerning because they were recommending that I do a chemo that there was no real evidence that it was effective for stage 3. And then I developed a severe case of, it's called PPE, or HFS, hand-foot syndrome, which looks, if you've had kids, like hand-foot, it's basically severe burning of your hands and feet, like where you lose layers of skin. And mine ended up being grade 3, which is really high. And so basically it became obvious that they wouldn't test me for it. The chemo they switched me to, which wasn't supposed to be effective, so that concerned me, because I didn't understand why they were putting me on that, and they were not wanting to test me for this deficiency. And yet it was coming together that I seemed to have all these symptoms. So the long and short of it is, I was encouraged or pushed a little to look for another oncologist, which terrified me because I'd already had delays in treatment.
Right.
And I thought, well, if I can't trust this doctor, who can I trust?
Right.
My mom, bless her, did a lot of research and got this, basically the same name kept coming back to us, which maybe was the universe saying, you know, here you go. So we did a consult with this oncologist at the end of January, and my chemo had been, my second chemo was January 4th. So, I mean, I'd already, but they couldn't do chemo because of how severe the reaction was. She's the one that looked at me and said, that's the worst reaction I've ever seen. And she wouldn't do any chemo without the genetic testing. So she did that among other testing, and it turned out that I had the gene. So they have to lower, it's the 5FU for people that are on FOLFOX, or that's, I'm not pronouncing it right, but 5FU, which again is in both of those chemos. But so they had to lower the amount because my body can only process. So if you're supposed to get 1,000 milligrams, I don't know what it is, you know, I might get like 400. And
right.
So they had to watch that to see how my body reacted all the way through. And so the point is, had I listened to the oncologist I was going to, I don't know what would have happened, because they were wanting to treat me with this chemo that A, was poisoning me, and B, that there was no known evidence that it was effective for stage 3 cancer.
Yeah.
So I don't even really want to think about.
Right.
But when I had a moment of strength after everything was said and done, I wrote them and told them, you know, very calmly and, you know, without anger, but just where I thought that their practice needed to be looking, and that people were human, and well, essentially, you know, that it's, I don't even know what to say, but I guess the point is, my chemo was delayed, you know,
Yeah.
knock on wood, it doesn't seem to have affected the long-term outcome. I went through a lot of physical suffering, a lot. And had we not learned about this test, had we not learned about this condition, there comes the research part again, and had we not self-advocated to switch oncologists during the middle of chemo, I don't know that I'd be sitting here today.
Right.
And I know that's like a big, huge example of self-advocacy, because there's a lot of other ones that are small, even saying I need nausea medicine or anti-anxiety medicine. But I can't say enough about speaking up for what you need to know. You should be able to understand your treatment, why they're doing it, why they chose that.
You need to understand at least what's going on and how they're making the decisions. And you're right, we've heard a lot of examples of maybe smaller or mid-sized sort of self-advocacy moments, and then yours is one that was probably life-saving from what I'm hearing. And I know you don't want to dwell on it, but I think it points to the importance of the entire range of why people at the core of it should feel comfortable at least asking questions, right?
Mhm.
I don't know what it is, but it feels a bit like patient culture to not want to be that, oh, I'm psychosomatic, or, oh, I don't want to be that naggy patient. I don't want to be a bad patient. It's not
Mhm.
being a bad patient. It's being, a smart one, one who's advocating for themselves. So thank you for sharing, the entire, I know it's probably traumatic to talk about it, like, the amount of things that you had to go through. We just have a little bit of time. So I really want to make sure too, because I know you wanted to talk about both support and survivorship. Um, with the support piece, you did talk about it a bit before, and I'm really glad you had that in your community. Do you have, I guess, maybe tips for people on how to ask for support, or what support they may need? I mean, you are a parent, but at the time you had other responsibilities. And anything along those lines.
Yeah, on the support piece, it's hard, like many of these things, for any of us to ask for support. I mean, my husband and I both fought it. Our friends wanted to set up a meal train and help with kids and whatnot, and I really fought it. And then someone said to me, and I forgive me if I'm wrong. I feel like it's the Jewish culture, but I'm not 100% sure. But in another culture, that it's an insult to not accept help. And because in most cases, people want to help. And it's not that we have to go out and say, please help me, please help me. I mean, we maybe do in a specific situation. And that's another piece I would say, because it is hard to ask for help. But I think what I learned in that situation for myself, and also in helping other people since then, is when you accept help, you're giving a gift to other people. They wouldn't be offering it if they didn't want to. And so it helps you more than you even think it will at the time. Because when you're just starting out, you don't think necessarily you're going to need help because you don't know how you're going to feel. And if you feel great, you can also cancel or postpone it and people will understand. But the biggest thing is allowing them to help.
Right.
And we had so many blessings of that. And then the other thing I'll say is, for the people that want to help, the people that need help don't always know what they need.
Yeah.
They don't want to ask for it. And so I'm guilty of it because it's hard to think of things. But what I learned from that experience is, if you don't know how to help, or if if they say if you say you want to help and they don't know what they need, just do something. Examples are, bring bagels and cream cheese, because if they have kids or even them, you can have that for snacks and meals and all kinds of things. Or we had friends show up and put up our holiday lights. I mean, that kind of thing. Or, you say, I don't know if I'm hungry, because, and they say, well, I'm bringing you, a burger. So do you want a vegetarian or this burger, or which kind? Because I'm going to bring you a burger. So you might, basically, honestly, the times that I didn't know what I needed, and I don't mean to always force something on someone, but even visits, sometimes you just don't want them. The worst thing that happens is that someone comes and they just drop something, or they just yell up the stairs or down the stairs, hello, I love you, or because there's times where there was a time I thought, I don't want to see anybody, and I told my husband to make them go away, and it was a good friend, and she didn't, and she came and sat on my bed, and we just had the best conversation. about nothing.
Mm.
And so I think I'm kind of rambling, but I guess the importance is accept it,
Right.
and think of, maybe you don't think you need it, so give them the gift.
Right.
And if you're the person wanting to help and you don't know what to do,
Do something.
or do something simple.
Yep.
And it could be sending a card.
Yep.
It could be sending texts. I mean, a thing that meant so much to me is people would send texts with positive quotes.
Right.
Or they'd give me these little, like, bracelets or necklaces or little rocks with, a symbolic word, or,
Right. Right.
you know,
Support shows up
small. It
in so
doesn't have to
many
be.
ways. Yeah. Yeah. Support shows up in so many ways. What I'm hearing is for people who want to help, just do something. Don't ask. Asking is sort of a burden too on the person, especially. Maybe be specific too in your offer to help. Um, the,
Yeah.
I love all of those. We'll make sure to get those up for sure. My last question to you is something I know you also feel passionately about, which is survivorship, which is, we could spend a whole nother hour on it, I know. But I guess for you, what has been the biggest lesson or hardest part, or, anything about survivorship that you think is important for other people to sort of know?
Um, I think it's important for other people to know that it looks different for everyone. We imagine we're going to feel great to work out through our treatment, or we're going to continue working through our treatment, or, I'm going to be the person to work out when I'm pregnant, or, these things where we have this idea, I'm going to be done with treatment, I'm going to go run a marathon. Maybe someone is, but to not to have no expectations, but to be forgiving and loving of yourself, and knowing that you are a survivor the minute you start treatment, or even diagnosed, you're a survivor, and that's a wonderful thing to celebrate. But when treatment ends, life doesn't magically go back to normal. I was told by a doctor that I have beyond most respect of, that he said, and he knows me well, he was my sports athlete doctor before everything else, and he said, you probably won't feel like you can do everything you want to do for 3 years. And it didn't, I kind of looked at him, but he knows me well enough, and over time I kind of knew, I didn't get mad, I knew what he meant, and he just meant, like, maybe you're a marathon runner. Well, maybe you'll run the marathon, but maybe you won't feel like you run it to the standards you think you might or had before for the 3 years. It's a general marker, but just saying that there's things that are going to feel better sooner, and there's things that are going to linger, and that it doesn't mean you feel horrible for 3 years, but that maybe you don't hike as fast, or you don't jump out of bed, or, as we were talking, I had occupational therapy, my memory, my recall's a lot better now, but for that first year and a half trying to remember a word, I'd be like, don't tell me. There's things that just take time.
Right.
And so I think it's hard, and it's hard to accept. It's also, I will say, a bit hard with the outer world, because you start looking better and people think you're better. And in a lot of ways, you're still recovering, and you're still maybe suffering, depending on, again, everybody's neuropathy, different people have different things. But there is a bit of a challenge, I'll be honest, with the community, of, unless it's your closest friends that you tell and are really brutally honest with, that there's not really an understanding, and there is more and more in the medical field, but still, even in the medical field, I'd say it's pretty still new, and there's papers and stuff written now about the long-term effects, but just to know it does get better, and maybe not, there's a few things that never go away, but not everything stays rough, and not everything goes away immediately.
Right. No, that's so important to note. And also the point about how people see like, oh, you're done. Oh, Shelley's done with treatment. They say cancer free, and they say, you know, well, she's done. And the level of support too, naturally, you know, will drop off, and it usually is pretty abrupt. So I'm glad that you went through all of that. But I am most of all just really grateful for the amount of time that you've given to sharing your story with us, because you really, I think, shared so vulnerably. And so I really appreciate it. And I know the people who are reading and watching this will appreciate it as well. So Shelley, thank you so much for you know, joining the Patient Story community and sharing yours. We really are grateful for the time with you.
Thanks for all you do.